Welcome back to Body Beautiful. Right now we're talking with Sima Hilde from New Look Institute in San Jose about hair loss, how to correct it, how to deal with it. We'll be taking your phone calls. The number 800-440-4884. We'll also be posting the number for New Look Institute during and at the end of the segment. Remember, any advice we give you today, you're going to want to get a second opinion. I wasn't kidding when the phones rang off the hook. I think because we talked about the taboo, the kind of shame associated with hair loss.
We have all type of shame with hair loss. Women mostly think this is really not something they want to deal with. They try to think of other way of looking younger rather than taking care of that hair loss. You're absolutely right. It's, as I want to mention that, say if you want to have Botox to look younger, that's very exciting. But if you have hair loss, you try to back home and do whatever you can do. Don't bring it up. Don't talk to anyone about it, and just wait and wait. It doesn't go away, but there is no shame to it. It really isn't.
And you know, we talk about all kinds of plastic surgery on this show, and it does seem to be sort of the norm now that you can say, okay, I do fillers, I do this and that, a little nip and tuck. But you're right, when it comes to hair, you know, we try to cover it up. There are wigs, there are hats, and as we're doing this interview, I see you just looking at my hair. It must be tough when you go out in public. You're kind of looking to see, you know, what's going on.
I'm always looking.
All right. So why is it? It seems to be, say, for men, it's a little bit more standard to talk about hair loss and baldness. But for women, why are we so, I don't know, you know, protective about it?
I talk to many, many ladies on a regular basis, and they let hair loss they have had 5 years. They know hair loss has been in their family for years. But there is such a great amount of hair loss, it's hard to work with them with preventive.
Okay, can you turn it around? Can you stop it if you've just started?
It depends when they come and see us. If they come in after having 5 years of hair loss and knowing their mother had a lot of hair loss, their sister did, and it's very thinned out, I cannot do preventive. But if they come sooner, there's definitely preventive available. But when they come in with a lot of hair loss, yes, we have so many options with augmentation, extension, different way of making you look fantastic.
Now, you know, we must have touched a nerve, because I'm looking at the phone lines and they lit up instantly. So I guess we have viewers who are not afraid to talk about it, and we will get to your calls, I promise you. But before we get to that, I mean, what's the norm? I mean, we lose, what, 100 hair strands a day just normally?
The hair loss that we have, just me and you, being fortunate not having hair loss, we just lose hair and every day is replenished. But the ladies who lose hair loss because of genetic reason, once they lose hair, their new follicle doesn't come out. They don't grow hair, so it keeps adding. The hair loss gets to be bigger and bigger, and especially when it's on top, it's hard to hide it. Do you see what I mean? So we grow hair as we lose, but some people don't grow it because, again, it's androgenic alopecia. That's what they have.
And that's a big scientific name. We want to get into that topic in a minute. But also, women lose hair through hormones, too. I mean, a friend of mine, after she had her third child, started losing, you know, locks of hair. It eventually grew back. But are there times and periods in a woman's life where, you know, you're just going to suffer, but then you get back to normal?
Yes. Sometimes the hair loss because of hormonal change will correct itself with time, and sometimes it doesn't. I don't have a magic answer for that, but yet the hair loss because of hormonal change for menopause, especially ladies with menopausal time of their life, it doesn't come back. Sometimes with childbirth, they lose hair and it comes back, but many, many times it doesn't.
Sima, as I said, the phone lines are ringing off the hook. I have a million questions too. Stress-related hair loss, washing too often, but we need to take a quick break. For more information about the New Look Institute, call them, 800-966-4472, or you can check them out on the web at newlookinstitute.com. And when you call and mention Body Beautiful, you'll be able to receive a complimentary consultation and scalp analysis. We'll talk about that. That's until the end of May. Coming up, we'll get to those ways of how to get gorgeous hair. Maintain what you've got. And we'll look at some before and after pictures when we come back on Body Beautiful.
The information and advice given on this program is for general informational purposes only. For medical advice on specific treatments, medical professionals should be consulted. You should not initiate a course of treatment without consulting a qualified doctor. The opinions expressed on the program are those of the guests and not those of KRON TV, its management, employees, or advisors.
Welcome back to Body Beautiful. Right now we're talking with Sima Hilde from New Look Institute in San Jose about hair loss, how to correct it, how to deal with it. We'll be taking your phone calls. The number 800-440-4884. We'll also be posting the number for New Look Institute during and at the end of the segment. Remember, any advice we give you today, you're going to want to get a second opinion. I wasn't kidding when the phones rang off the hook. I think because we talked about the taboo, the kind of shame associated with hair loss. Let's go ahead and roll the before and after pictures, and then I'm going to just jump right into these phone calls.
Sure.
I've got some great people on the line. Okay, so. What?
This lady has definitely hormonal related hair loss, and as you could see, her hair also breaks on the bottom. So we have created a beautiful look for her without any doubt. She's not wearing a wig. It's a beautiful augmentation. Yes.
So by hair restoration, what did you do with her briefly?
For her, we added a very small amount of hair to the top of her hair. It's non-surgical, and we also preserve her hair on top all the time. We make sure that nothing is being cut down or thinned out underneath. It's the technique that we use. There's so many different techniques at New Look Institute. There isn't enough time for me to analyze and explain everything.
Okay, and this gentleman here?
This gentleman has definitely hair restoration. For him, he doesn't have any hair on top. So we have used a very thin like a lens of hair going on top of his scalp, and it's attached to the scalp with a very, very thin layer of adherence.
Okay,
so
but
he
this
looks
is not a toupee.
No.
Okay.
This is a 1 month.
He can shower with this, swim with it?
Yes, you can shower, swim, exercise, enjoy life.
Wait, it really
fully.
changes his look,
Yes,
doesn't it?
yes.
Okay, let's go ahead and look at the next picture.
And this lady has genetic hair loss. Her mother had hair loss, and the sister has hair loss. It's more genetic, and we've done the same thing for her. We've noticed that she wants more hair on top. Whatever we've given her on the top of her hair has complemented even the back and the side. So she's really looked natural.
All right, do we have one more picture here? Wow. She
has extensive hair loss. Her hair loss is almost as if she wasn't coming to a hair center like ours, as hair replacement studio, I'm sorry. She would be ending up wearing a wig. We have created really thin augmentation that allows her to show her side hair on the back and preserve her hair on top and yet look fantastic. Looks very nice.